Canada stands on the brink of a healthcare catastrophe. Emergency rooms across the nation are at a breaking point. Our devoted healthcare heroes, doctors, nurses, medical staff, they're trapped in a relentless cycle of burnout. Officials in charge are deploying every strategy in their arsenal to stem the tide of this epidemic. They know we need solutions to slash ER wait times and are working tirelessly to solve this. But our duty doesn't end there. We must pioneer strategies to ensure such a crisis never happens again. The very pulse of our country, the health and well-being of our people depends on it. The time to act is now, before it's too late. My name is Russ Evans and I'm a mobile healthcare advocate. A couple of years ago, my mom was diagnosed with cancer and 7 weeks later, she passed away. The final moments of her life were spent in an emergency room that was way overloaded. And that's the challenge that I want to talk about. Now, I can't say that she would still be with us if the emergency room wasn't as full that day, but what I can say is that I'm going to do everything in my power to give healthcare workers a fighting chance to save someone else's life to live another day. Reducing the load on an emergency room, even if it's just by a fraction, can be the difference between life and death for a patient, which is exactly why I believe that mobile healthcare is the answer to the long-term solution. But before we get into that, we need to examine the current state of our healthcare system and how we got there. Our healthcare system falls under the Canada Health Act. The CHA's primary objective is to protect, promote, and restore the well-being of Canadians. And it's meant to do so without financial or other barriers. So how is it doing? Wait times are 30 plus hours. We're now moving patients to unmonitored hallways to make room for critical patients. Someone will die unnecessarily. And unfortunately, they were right. Winnipeg has seen 2 deaths just months apart of people waiting to receive care in an emergency room. And one of those people waited over 33 hours for care. In a 12-month period, 1.3 million Canadians left an emergency room without receiving care. That's 8.6% of those that sought care left without receiving care. In 2022, a 67-year-old Cape Breton woman went to the emergency room with a sore jaw and flu-like symptoms. She waited for 7 hours. She gave up, went home. Within 1 hour of getting home, she passed away. So, how did we get here? Before the pandemic, the healthcare system was struggling. In the 4 years since the pandemic, it's been pushed to the brink of collapse. Contrary to public belief, the healthcare crisis is not because of a lack of funding. A study by the Fraser Institute found that of the 30 countries with universal insurance coverage, Canada ranks the highest spender on healthcare as a share of its economy. Naming one thing that has led us here is absolutely impossible. A worldwide pandemic, a high-stress environment, staff shortage, all these things have accumulated and led to the overburden on our emergency rooms. Healthcare officials are searching for solutions. We are in dire need of a short-term solution, but long-term, I believe that mobile health is the answer to preventing emergency room overload. Mobile clinics give caregivers the option to bring healthcare to the communities before an emergency room visit is required, detecting diseases early enough to be treated, saving lives, and really giving confidence to communities. In a mobile clinic, you can do primary care, first aid, screenings, blood tests, teeth examinations, eye examinations. The sky is the limit. A mobile clinic in London, Ontario reported that they prevented 1,000 emergency room visits in 1 year. TELUS Mobile Health has reported that 36% of their patients would not have accessed healthcare otherwise. Let's look specifically at flu vaccinations for a moment. In the 2022-23 flu season, only 43% of Canadians over 18 actually received their flu vaccine. The number one reason that they did not get their flu vaccine was because they just simply did not get around to it. Meanwhile, 6% said they had a hard time booking an appointment, and 4% said that it wasn't available to them in a convenient location. The CDC has stated that those between 18 and 64 years old are 23% less likely to be hospitalized with the flu if they receive their vaccine. Those over 65 are 41% less likely to be hospitalized with the flu if they've got their vaccine. The CDC has also stated that by receiving flu vaccinations, millions of medical visits can be prevented, tens of thousands of hospitalizations can be prevented, and thousands of deaths can be prevented. So just imagine the impact that we can have on society with mobile clinics. We could take a simple vaccine clinic, we can go to businesses, we can go to rural communities, we can go door to door, we can go to homeless encampments and offer vaccinations that we've just heard that will prevent medical visits, hospitalizations, and deaths. A study showed that a single mobile clinic offering preventative healthcare services provided $20 million in value in just 1 year by reducing ER visits. The return on investment was calculated to save $36 for every dollar spent on the mobile clinic. Why doesn't Canada have thousands of these mobile units on the road already? Well, the good news is it is starting to happen, sort of. Some provinces are leading the way, others are lagging behind. But with the current state of healthcare, we don't have time to wait. Our doctors, our nurses, our emergency rooms, our healthcare providers, they need help. And most importantly, what Canadians need is a healthcare system that they can trust to protect, promote, and restore their well-being without barriers. Mobile clinics may not reduce emergency room wait times tomorrow, but by investing today, we are setting ourselves up for a much brighter future.